Good afternoon, everyone, and welcome to the webinar on immunity and mental health in pandemic and concurrent disasters. This webinar is organized through a joint collaboration between National Institute of Disaster Management, NIDM, and Radhi Disaster and Education Foundation, which aims to address the challenges and way forward on pandemic and concurrent disaster response. To start the webinar, I request Mr. Santosh Kumar from NIDM to do the honors. Mr. Santosh Kumar is a disaster risk reduction, policy planning, and capacity development expert with 25 years of experience in different positions in the development planning and DRR sector. A PhD in economics, he studied gender and development in IDS Sussex, UK, and received professional training in disaster risk management from Israel, backed with international work exposure at the World Bank and intergovernmental body of SARC. Over to you, Mr. Santosh Kumar. It will be a pleasure to hear from you.
Good morning. Thank you very much to all of you, Mr. Asif and Dr. Rita, and we have from National Institute of Disaster Management, Major General Manoj Kumar Bindal, the Executive Director of the NIDM, and Dr. Ajinder Walia from our side, coordinator of this particular joint event between the two institutions. We are grateful to the institution which has joined hands with the National Institute of Disaster Management for this very, very important event, which we say as a kind of this is very, very important event in terms of taking this issue of mental health and immunity together. So how immunity and the mental health can actually work together, and we can work together for this currently, because I was just sharing this and the pandemic and concurrent disasters, how it gets affected. Like my brother is currently last night became very serious, and this morning we wanted to shift to the hospital, and the whole family got traumatized, and we are not finding the right place to go and all. So what I'm saying, this not the patient alone who suffers, but the affected person, like our entire family got affected with this and into trauma. Similarly, those who are attending directly to the patient, they are actually horrified in terms of this, and nobody wants to. The neighbors don't want to go and visit the patient, and also even your close relative also doesn't want to go and see the patient, and this leads to a kind of a different kind of a trauma, anxiety, and the challenges which we have. So this particular course is, I'm sure this would address this issue in terms of that how effectively we are going to address for many people those who are into going through this kind of a process. So I'm sure this Dr. Jindawalia and the entire team who is interacting and taking sessions would be helping in terms of those who are likely to get affected, who are not affected as yet, but how to be mentally prepared for such kind of eventualities. We do not know. We say that everybody is a carrier of this coronavirus, but never know who will be affected the most. So this is only the time which says that yes, now you are affected. So how during the pandemic and also that other disaster happens, that cascading disasters like that, we had cyclone, we may have floods, we may have even earthquakes, we are having heat wave, we are having forest fire, and so on and so forth, many things. The responders, suppose in the government, they remains the same, whether it's a forest fire with the COVID-19 and or whether it's a flood or the cyclone or pandemic. So their challenges is also much more the service providers. How the service providers can be rectified with their mental health process, and they can also develop immunity. We are talking about today herd immunity, and all the unlock has happened today. Every state is open and every state is going for lockdown. So that kind of approach which we are finding it, we do not we have not understood properly the virus and how it is behaving. At times we decide for closing up, we are decide for the non-closer, then we decide for the large number of victims, then we don't find that availability of the hospitals, the readiness of the hospital. We are running also from pillar to the post. We are realizing as a victim also. So this needs to be addressed. That how new normal to be addressed in future. I don't have much to add here. Just I would like to wish all the very best in the beginning of this as a divisional head, and I would definitely request Dr. Rita and also our executive director, Mr. Major General Bindal, to kindly give the enlightening thoughts so that the participants and the resource person can deliberate upon this. Thank you very much for giving me this opportunity.
Thank you, Santosh Kumar sir. Our next speaker is Major General Bindal from NIDM. Major General Bindal is presently the Executive Director, National Institute of Disaster Management, that is NIDM. An alumnus of National Defense Academy, Major General M.K. Bindal is a graduate of Defense Services Staff College and has attended the prestigious Higher Command course at the Army War College, besides excelling in all other career courses in the Army. He holds a master's degree in Defense and Strategic Studies, as well as Masters of Philosophy in Defense and Management Studies. I request Major General M.K. Bindal to give his keynote speech on the webinar. Sir, over to you.
First of all, I welcome all the participants who have joined this important webinar, which talks about immunity and mental health in pandemic and concurrent disasters. I congratulate Dr. Rita Savla, founder of Radhi Foundation, and Dr. Ajinder Walia, who's coordinating with this program under the divisional head, Officer Santosh Kumar. And the speakers, we have a list of very eminent speakers who will be speaking on very important subjects hereafter. Initially, when the pandemic came, it created a lot of panic. It created a lot of panic for the first few weeks. There was panic in buying, panic hoarding. People didn't know what to do. And slowly, when more news started coming out, some clarity started coming out as to what is happening, what is not happening. The rumor mongering slightly went down due to interventions of the government. Then it gave way to fear and also anxiety. And now it has given way to frustration, because now it has been so long that people are now frustrated as to how long will it last, because we have done everything but we can't save ourselves. So that frustration is now setting in, which can also give rise to complacency in near future, which will again taper the curve steeply upwards if not taken care of. Because in Spanish flu, 1918, we saw that the worst spike came in the second wave when people became complacent. And that is how they started coming out. They started following their own routine and suddenly it spiked. The second wave was more serious than the first. So in this case also, all these thoughts are going on in our minds at all times. Anyone who's, whenever you open a TV, whenever you talk to someone, whenever you discuss these issues, such issues come. When will it end? Will it increase? When will it start flattening? What will be our future? When will our parents be able to go out for a walk? When will I show anyone to a doctor under safe conditions? People have medical interventions have been stopped to a large extent because of fear of contracting this particular virus. So there are a large number of issues which is creating mental stress among the population. Everyone, it's not only the last mile, it is right from the first to the last man. Everyone is worried about it. And moreover, on top of that, we are having different disasters which are coming in various areas. Somewhere floods, somewhere cyclones, somewhere landslides. So that itself is again giving rise to another sort of problems. And now we are getting news of bubonic plague. We are getting news of bubonic plague. We are getting news of Black Death from Kazakhstan. So there seems to be no end. And that is what we need to intervene and ensure that the people don't panic and people take it the way it is supposed to be taken. And this can be done only by health experts who can give the right amount of advice and social experts who can give it in the right way with proper communication so that people fears are allayed, and they need assurance. They need assurance in some form, and hence these webinars come in handy to assure people, and the participants are expected to pass on the lessons or the key takeaways of this webinar to whomsoever they can, so that the outreach becomes that much bigger. Now, because there is no end in sight as of now, people need to work. People need to work, and they need to go out, so that race for gaining immunity is increasing. 101 formulas are there in the world today, which talks about how to get immunity, what is good for us, what is not good for us. And we are all, well, including me, and I think everyone, is doing something or other in their own wisdom to improve the immunity of the family. Either we are taking vitamin C or zinc, or someone is taking Kara, someone is taking Ayush mixture. So there are ways and means we are trying to get immunity, but this particular process is also causing a lot of mental stress, and psychosocial issues are cropping up, because suddenly it has altered our lifestyle. It has altered our lifestyle in the house also, washing the hands frequently, sanitizing them, drinking warm luke water whenever required. So all these issues, once brought together, uh, need to be addressed holistically, for which we have a very good a panel here, Dr. Raman Gandhikar from ICMR, who will talk about medical intervention. We have Dr. V.N. Gangadhar from NIMHANS, who will talk about the interventions required for mental stress. And we have Dr. Rita Savla from Radhi Foundation, who have developed a particular tool, which I think she'll be talking about, in which the people suffering from any psychosocial issues can check themselves and take corrective actions. So I'm very sure this is going to be a very, very interesting webinar today, and I'll be listening to the whole of it. And I wish all the participants good learning, and I'll expect the participants to ask good questions through the chat box without disturbing anyone by switching on the mic, and so that the right lessons are taken home by each one of us. Thank you so much. Over to you.
Thank you, Major General M.K. Bindal. Thank you for giving us a theme for the webinar, primarily setting up the theme on what is immunity, and introducing the speakers out here. Now I request Dr. Raman Gangakhedkar from Indian Council of Medical Research, ICMR. Mr. Gangakhedkar is been honored with Padma Shri for his service and research on HIV/AIDS. He has been instrumental in formulation of policies to handle Nipah outbreak in Kerala in 2018, and now for COVID-19 pandemic. Now I request Dr. Raman Gangakhedkar, Chair ICMR, to present his views on pandemic challenges and probable solutions. Over to you, sir.
Yeah, just. Am I audible?
Yes, sir, you are audible.
Yeah, I thank the organizers, NIDM and Radhi Foundation, to have given this opportunity. Just one thing which I would clarify first is, though I belong to ICMR, I used to be ICMR spokesperson. So these views that I am expressing are my own and not of ICMR. And the reason why I'm stating this is any view that comes out becomes a major controversy otherwise. Now let us look at the backdrop. Now, currently, we are talking in terms of global infections of 1.38 crore people in 6.5 months, about 5.89 lakh deaths. Totally, you have close to about 1.38 crore people who are infected in 6.5 months' time. We have 5.89 deaths, lakh deaths that have occurred across the world. And India today, we crossed 1 million infections as such, but the deaths, the mortality perhaps is lower. You have about 25,000 plus people who died due to this infection. The number of cases detected every day is expected to increase, but our mortality per million population continues to be low, which is a heartening feature of the same. But why is this such a rapid increase in the caseloads? One issue which we all understand is high transmissibility of COVID-19. The non-specific symptoms perhaps make people linger at home longer, and then they transmit infection to others. But the key drivers, which are fixed drivers, are population density, mobility, and migration. Now, metropolitan cities and large towns tend to have the highest vulnerability due to these key drivers, and the population size is extremely high for these metropolitan cities. And unfortunately, the seeds of infections also established quickly in these cities, so the numbers tend to rise very rapidly. Now, one of the things which we need to realize is we could delay the onset of this outbreak, despite the fact that we are second most populous country in the world. And this was possible only because of early lockdown that we had and promotion of non-pharmacologic interventions to almost all, utilizing the time to enhance testing capacity, enhance access and indigenous production of diagnostic kits, increase the capacity to handle sick patients, create an enabling environment through indigenous PPP and handholding or training that was provided to healthcare workers. If you look at the global control situation, you find that some smaller countries such as New Zealand, South Korea, Japan, and perhaps a very large country like us, China, there the infection appears to have been controlled. However, we need to remember that the vulnerability continues to exist. Smaller outbreaks will continue to occur and are being reported from these countries as well. One of the lessons that we will have to learn is even in the best case scenarios that we control this particular infection, one cannot lose our own guards. Early detection, isolation, and contact tracing will have to be continued from wherever, whichever imported cases there are, whether from other countries or from regions where this outbreak is little more severe. Now, if you look at what are the key challenges for us, ours was an imported outbreak, and one of the things which has been seen is heterogeneity in level of outbreak in different states. Efforts to protect the states having low level outbreak are going to become vital over a period of time. The solution is we could think in terms of safe migration for workers. And when we say safe migration, perhaps isolation for 2 weeks from arrival into the city where they want to migrate and offer of tests to them would become vital. If you think in terms of mobility, which is far more damaging in terms of increasing the infections within a metropolitan city, you find that it is difficult to control in any given area. Safer transport and non-pharmacologic interventions will have to be promoted strongly. But when you say safer transport, the cost of transport is going to increase immensely. And therefore, perhaps, those, if you think of Bombay as a city, you find people come there for small businesses for a short period of time. They come from areas which could be 100 kilometers away. Some kind of a cooperative movement to minimize travel would have to be initiated for the reasons for which they tend to come to sell whatever goods they have. Now, most of us tend to think that immune passport, which was promoted mostly by Gates, it's something which is feasible. But to me, it appears to be distant. We don't have evidences on immune protection, whether it is there, nor do we know duration of protection, nor do we have evidence of reinfection occurring in 3 months. And naturally, in presence of different non-specific infections, such studies are also going to be pretty complicated. And therefore, we need to worry that perhaps immune passports is not going to be an immediate thing that might happen. If you think of diagnostic tests, this is a prerequisite for isolation. Unfortunately, RT-PCR has low sensitivity despite the fact that it is a gold standard. Selection of primers. Now, can we improve this? Yes, it can. Selection of primers, ability to pick up low viral loads And ideally, development of a point of care test should be able to overcome these problems. A simple, cheap point of care test, which is feasible even in the field, will reduce the reliance on high throughput machines, which actually delay the diagnosis and subsequent admission if it is required. Antigen test is also one such example as a good variant as to how we are overcoming the delays in diagnosis itself. Both are likely to improve as second generation of tests. Today, most of the tests, excepting this new one that has been developed by IIT, the rest of the tests were developed on far earlier knowledge that we had, and we should be able to see more second generation tests which will help us in diagnosis as early as possible. Now, when it comes to antibody tests, there is little known as to how you can use IgA and IgM tests effectively. And development of effective tests with some kind of understanding about these antibodies would be extremely crucial. Now, once you diagnose, you need to isolate people. Now, if I have to isolate people, one can go for isolation of patients with minimal symptoms and asymptomatics is something which is done as home isolation. However, admission of such cases in hospitals can reduce the availability of beds to those who need it. But you might find that this is one feature which instills a lot of fear in the community. We need to understand that we may have to adopt different alternative models. One could be isolation at home, but we need to have appropriate gadgets such as pulse ox provided to them, or a gadget which can detect any change that could be crucial can also be provided to them for a short period of time. And we need to have a research on predictors of impending severe disease among them. If we can find a biomarker, perhaps it would be extremely useful. Now, when it comes to alternate model, there is a private commercial model, which is more like a nurse practitioner model that you see among in USA, where the nurses tend to monitor patients at home with a backup of teleconsultation from qualified physicians and move the patient to the hospitals whenever needed. One requisite will be, this will be something which we will have to think seriously, because all of us know that people who are older, people who have chronic morbidities and they are doctors, they are reducing their practice or don't want to practice anymore. Now, if it is telemedicine related practice, can I not train them as primary care physicians and try to utilize their skills appropriately for teleconsultation? You start training nurses as nurse practitioners is another issue that comes to my mind. Those who are living in population dense areas and are being isolated, are being found as positive, you need to shift them, these infected cases, to an appropriate facility, because they can't have these non-pharmacological patients followed so easily because of lack of space. You may need more of makeshift sites for it, which can be dismantled as the outbreak tends to become less and lesser in any given city or a given area of the city. Importantly, provision of support for daily necessities such as food and medicine and daily utilities to affected families is extremely vital. And that goes in line with Maslow's hierarchy model. Unless we do that, the panic will not be reduced and people will not hide in that case. You need to involve CBOs and self-help groups wherever they are existent in order to provide this particular service. Now, when it comes to contact tracing, you need to overcome some challenges. One is stigma, fear of death, ostracization of family, and probability of finding some family members as infected tends to bother anybody who wants to undertake testing. Hiding infection and also the at-risk contacts, just because of such fear, is a common occurrence that tends to be there in the community. We need to provide counseling support, train the peer counselors on communication skills, enable stigma reduction, IEC or BCC, and emphasize lower risk of death in all such activities, the infection will also be more common among those who belong to low socioeconomic groups. Now, provision of ration and economic support could also be an important issue that might arise. Now, when it comes to hospitals, there is a need of adequate number of ventilators, considering that the nature of outbreak, which tends to have a Gaussian kind of a curve, one must also start understanding, can I provide a temporary support to have more number of machines, whether it is rental or are provided by the government in itself, something like you do mobile labs, you try to have something which is relocatable to different areas also. Now, adequate and quality provisions of PPE is extremely critical, and strategies to reduce burnout, the duty hours, and the holidays that tend to alternate are extremely important. Here in Bombay and in Maharashtra, they tend to have 7 days of holiday, 7 days of work in ICU. Some places they also did 15 days of work and 15 days of holidays. One needs to reconsider as to what would be appropriate. But if people burn out, that will be one of the worst things to happen, given the fact that our healthcare workers' numbers are pretty small. Now, you also need to provide psychological support to all these healthcare workers through appropriate counselors as such. Now, when it comes to medical manpower, currently most of the residents who belong to any specialty, they are posted for COVID duty. Now, this affects quality of care as well, and it may also impact training in different specialties in future. Now, can we have one term in COVID and then they return back to their specialty is something which we have to think about. Have specialized teams of experts who can be coming for assistance from different states where the level of outbreak continues to be lower is perhaps another alternate model that we may have to try. Now, there is another thing that happens in the hospital. The emergency use authorization is currently being confused with standard of care. Now, that's something which is very, very difficult to understand, and we need to train people. We need to make the informed consent, which is required for this compassionate use, as a tool that is actually followed. Unbiased information on unknown efficacy and adverse events have also have to be discussed with these patients or their relatives when they are put on these drugs. And we need to emphasize that the quality supportive care can still make major difference in terms of survival, given the nature of emergency use authorized drugs and their outputs at this time. We need to tighten the access of emergency use authorized drugs, mainly because people are hoarding those drugs and there are different approaches people are trying to ensure that others get it at this time point. Those who require can get it. The bigger challenge will also come now during the natural disasters. Floods and earthquakes result into congregation of different people where they would not be able to maintain the non-pharmacologic interventions. And if that is the case, we need to think seriously as to how we can do that, because every such thing is actually going to add more number of cases in the community. So it would also mean that along with food and ration, perhaps you will have to provide to them all masks and such issues, along with some kind of film being showed to them why they should not come closer to one another, and the safe distance has to be maintained. With seasonal infectious diseases, there would be a major challenge that will come now. There would be co-infections that would occur of the traditional infectious diseases, and currently the entire diagnostic algorithm that we have tends to talk about COVID-19 alone. But you might get surprised when you test for malaria. Some of the tests are likely to come as false positive in COVID-19 patients also. So you need to develop robust algorithm as one of the key strategies as these outbreaks start. And these co-infections can influence the natural history of this particular disease. We need to watch, we need to conduct research as to how they behave and try to do our best to prevent morbidity and mortality. Will effective drugs become available? We need to remember that current approaches are targeted more towards repurposed molecules than development of NCEs, that is new chemical entities as such. Now, is that a good strategy? Perhaps, I take back because I come from HIV background. I would give a good example of HIV. Any discovery of a new repurposed molecule leads to rapid development of effective drugs. Now, take the case of HIV. In 5 years, it took almost 5 years to detect zidovudine in 1986. 1987, the trial started, and this led to an entire revolution because we understood how to manage, how to develop newer drugs against it and where the action is required. Same is true with the story of hepatitis C. It started with HIV. They started using lamivudine and tenofovir, and once they started using lamivudine and tenofovir, found that different DAAs could also be discovered because you then start becoming more confident, you know where to go, and you can develop drugs. We hope that all the global scientists will be able to get the first lead soon, and then we can move around. Now, why this kind of confidence? One of the reasons why I have this confidence is only because if you look at COVID-19 outbreak, you find that we used to think about certain risk groups where perhaps this co-infection is more likely to happen and could be more severe. Now, one such is HIV. You look at TB, you look at bronchial asthma. The proportion of people who are acquiring it compared to other diseases which are reported in as morbidities which lead to severe disease is far lower. We don't know why. Perhaps the answers will lie in one of these diseases itself and the way we manage them. When it comes to prevention and control of such infections, you require both. You require drugs, to my mind, effective drugs and effective vaccine. We know that 120 groups, over 120 groups are currently working over development of vaccine. Of these, about 7 have entered into phase 3 trials, and because they were found to have immunogenicity. Now, immunogenicity alone may not be associated with efficacy. We may have to wait for some time for phase 3 data that tends to come. Now, the reality is there are different novel approaches that are being developed with the tests, and being tested among these newer vaccines, which hitherto were never tried for some of the diseases or major infectious diseases as such. Let us hope one of them turns out to be a good approach and helps us overcome this disease. But one of the concerns is, like you see in dengue, there is a fear that there could be severe disease after reinfection that we will have to guard and watch for a longer period of time. And also the duration and the efficacy of vaccine could also be an important issue to decide. And even if you discover a vaccine, we have to ensure that it has to be quickly administered to the entire population, susceptible population, which is going to be a major challenge from industry perspective as well as public health perspective. When it comes to non-pharmacologic interventions, it remains to be the mainstay of prevention. Repeated lockdowns, and for a short or a long period of about 2 weeks, if you find today, it has almost become a trend that people tend to go for lockdowns of 2 days, 3 days, or 7 days, and there are few lockdowns which are occurring for 14 days. No, they will be fraught with severe economic impact. Now, how to lift up the lockdown is also something which is critical. It is based on mobility and vulnerability to acquire that perhaps the spread of this infection can occur. A phased opening of schools and educational institutes and religious festivals or congregations religious congregations is something which will remain as the last thing to happen. Safer industrial operation and guidelines for which ICMR has also issued, they need to be operated and implemented well. They would need a hostel-like place for their workers to live and work in shifts. Acceptance and sustenance of non-pharmacologic intervention, that depends on high level of community engagement. You could use peer-led model, community opinion model, which we called in HIV as CPOL model, and try to use BCC through these CBOs, NGOs, and self-help groups, initially to begin with as gatekeepers. That would perhaps help us in the long run. Though our outbreak may subside late, due to our early and lockdown, high heterogeneity that you find in the levels of outbreak, it would be important to focus on rural investments, and opening the international travel will continue to pose challenges. Even if we may be having higher infection, it may bring in different quasi-species. Do we think it will be an impact that will last on long-term basis? Perhaps not. Against the what may last is the new normal practices, but the optimism needs to be cultivated that by next year we will have better drugs and vaccines available. And therefore, the new norms will continue to exist for quite some time. The industries may become more mechanized. There is a long-term impact on living of this infection. Newer economic order may also lead to would emerge because of this contracted global economy, and perhaps finally what it will do is have a lasting impact on us. We would be outwardly happy and free world, whether we choose that or we look at inward peace as one of the criteria for happiness, is something which the time will tell. Thank you.
Thank you, Dr. Raman Ganga Khedkarji. Thank you very much for pointing out the right actions that we took, like early lockdown and training healthcare workers. Your pointing out importance of early detection, contract tracing, and isolation were amazing. Like we have to follow this across. And our next speakers is Dr. B.N. Gangadhar from National Institute of Mental Health and Neurosciences, that is NIMHANS. Dr. Gangadhar is the recipient of Sir C.V. Raman Award from Karnataka government and Padma Shri Award. He brings over 30 years of extensive experience in field of mental health from both clinical and academic perspectives. His areas of research include yoga, schizophrenia, public health, electroconvulsive therapy. Now I request B.N. Gangadhar, Director of MHAS, to present his views on mental health in pandemic and concurrent disasters. Over to you, sir.
Many thanks for inviting me to join this webinar. I see several of my colleagues being there. I heard most part of the previous talk on what are the preventive strategies and what are the COVID infection risk related issues that we listened. Wonderful presentation. What I will share maybe in the next 10-15 minutes would be how NIMHANS reacted to the COVID scenario as a mental hospital and other neurological hospital, and what are the lessons if we can learn from the whole process. I'll quickly run through the current disaster situation of COVID having occurred and what we did in NIMHANS. There are several areas where we focused: clinical services. We geared up the community mental health services to current situation. We added a lot of training and capacity building and produced several brochures and manuals for the purposes of educating the public. And I will go each one of them step by step. When it comes to clinical services, with the lockdown having occurred in March, we took a decision that we have to close the outpatient department. There are following were the reasons why we did that. One, the advisory was to utilize hospitals for emergencies was the advisory. Second thing was there was no public transport available in Bangalore. And number three, we did, of course, retain the emergency services and made an announcement that emergency services will be running. However, we took a decision that we should call our patients who have been in follow-up because they would be expecting to come to the hospital. So all the people who had received treatment 2-3 months earlier in a follow-up clinic, we took their telephone numbers from the records and we went on to call these people and requested them to come over to go over to one of the district mental health program centers in each of the districts or the Bangalore municipality hospitals where they can receive these medicines. We were very lucky that the mental health services of Karnataka have been extraordinarily good, and all the districts were willing to see these people if they come to their district center or the nearest PHC to receive these medicines. As many as about 11 clinics run by the hello.
Please continue, sir.
There was some noise. Okay, never mind. We also facilitated free drugs to be given in the Bangalore municipality hospitals, where if the patient was to receive free drugs as per our file, we send the medicines to these clinics so that they need not come through the city, spending time on public transport. If it was not available, spend auto, or even that was not available. To overcome all these things, we delivered the medicines to these clinics from where they received the medicines. We also facilitated telemedicine consultation where a video contact was possible, and we activated that, and we, of course, it was working. People were encouraged to use this using posters, media, and we gave a press statement also. So tele aftercare, the telephone consultations, and also we set up what is called as the IVRS, interactive voice response system. So people were to phone there, get an appointment, and on the phone call number, they had an option to indicate whether they were old patient who was receiving a treatment. Just have to give their hospital number, and we would trace the file, look at the file, and we would call them back or give a face-to-face appointment, or where possible on telephonically, we used to advise them how emergency it is to come or not come right at this point of time. So essentially, the entire purpose was to reduce crowding at the hospitals, which was very important both in terms of the patients not having any access to public transport and also to help maintaining distances and so on and so forth. We knew that we had to open the OPD sometime, and our OPDs are so crowded that this social distance is impossible to maintain in the routine situation. So when the lockdown was to close, we anticipated that it would be lockdown would be lifted, and we prepared extra shelters to make people stand in a queue at a distance, and had several triages created in the outpatient. So these are all structural changes that we made to help people go in to the outpatient areas, where the number of seating areas also were reduced so that the distances between people are sufficiently large. So we had on our own made about 15,000 calls. The calls are continuing. By the time I'm presenting now, the slides were prepared almost a week ago. We could have almost touched 2,000 calls. And the people who had called, people whom we had called, many of course answered. Some of the telephone calls were not the correct telephone numbers that they had given, but nonetheless, many received consultation, and as many as about 1,600 people who received free drugs, both in the BBMP Bangalore municipality clinics, and some in the clinics where they were able to reach the district mental health program clinics. So in addition, we gave about 150 telemedicine consultations. This number has phenomenally increased because we also have been giving such consultations to neurology and neurosurgery patients in the recent days. That number has not been added into this. We had about 1,700 people calling the toll-free number to get an appointment. This is again has increased now. For various reasons, we had a lot of difficulties in the initial days for people to understand, call an hospital for an IVRS-based appointment, considering that most people who were consulting us were from poorer background and who were coming to a government hospital. They were not very sophisticated in terms of these operations, but they quickly learned. And what used to be a few calls in the initial days, we started getting more calls, and the calls would be answered. They would get a registration for the call, and then a general duty medical officer would call them and allocate them whether to neurology, neurosurgery, or psychiatry, or they need not come at all, and it's not an emergency, or they would even be advised to take help from a nearby clinic or near psychiatrist if they are not from Bangalore or who had difficulty in traveling all the distance. So these are all clinical services which we were able to change over the course of time. Sorry, community mental health services we activated more robustly, and we did several service activities using the community mental health system. One of them was we had people who were being quarantined after they landed from an international or a national flight. And this was a group where we thought we needed to do something. And the Karnataka government's public health department, particularly the mental health division, gave us a lot of support. And we were able to contact many of these people over telephonically. This number is a little more than 1,600. I understand there are as many as about 1,800 calls were made, and reports such as boredom, social isolation, they have missed the job because they were kept under quarantine, fear that they would get infected and spreading infections to the family. They're going back to the family, coming back from Pune, Hyderabad, someplace, since their office was closed. And they're also worried about stigma. We, of course, counted the numbers of symptoms that they had. Majority of them had anxiety symptoms, depressive symptoms, sleep disturbances, suicidal. We gave appropriate treatment and counseling to these people. And this was a wonderful experience in terms of understanding what is the problem that on-field people are facing. We also had an opportunity to work with the Karnataka mental health team, and NIMHANS jointly made visits to migrant workers. Mental health of migrant workers, as you know, that there was a lot of talk that went on about how the migrant workers were treated, and we were able to reach many of them, and we were able to give counseling and education to these people, and this proved very helpful over the course of this pandemic. People got benefit from this. I'm unable to change the slides. I don't know why.
Hope it is in annotate mode, sir. Cancel it and press it.
How do I do that? How do I cancel it?
Press escape and try.
Hide that.
Or on the bottom of the slide, in the left
Yeah,
corner.
I think it went down.
Yes, yes.
Maybe I'll come back again. I'll come back. Yeah, there it is. So the migrant workers whom we assessed, about 5,000 of them, we made site visits. We looked at people who had pre-existing mental illness, and some of them had mental illness ever since the lockdown had been announced, and about 5 of them. And we were able to refer 15 people to different psychiatric centers where they needed hospitalization. And some of the concerns that they had was how long would this lockdown go? They had, they were very eager to go back and meet their family, fear that the employers would abandon them, the health of their children, and some of them also were pregnant. Substance use was there, although we did not give the numbers here. That was another concern. Alcohol is not available. We have been used to taking alcohol. So these are the concerns that they expressed. But some of them were addressed and they felt very reassured. Although the numbers whom we attended was not very high compared to the numbers of people who were migrant workers in the city. We also set up a helpline. Thanks to many institutions outside NIMHANS who came forward to be participating. Very interestingly, the health department, Government of India, said that it will now be hosted as a, this number would become a national number. And what we initially started from NIMHANS, very quickly, we had participation from CIP Ranchi and also from the Tejpur Institute, and many other mental health centers came forward, and we were able to get a huge number of numbers connected who were willing to answer, and we were able to receive as many as about 3 lakh telephone calls, of whom 44 or up to 50,000 calls related to psychosocial help, where we gave counseling and we went on to help them out. We also set up in this telephone helpline a separate line for healthcare workers. Healthcare workers who are stressed could press another digit, and then they would be received by more trained professionals. Although all the people who were on this telephone counseling line were also trained people, and we also did 1 hour training for them in addition to what they had already received. None social workers, psychologists, psychiatrists to answer these telephone calls from healthcare workers. With all these numbers are still going on ever since the lockdown was announced. We got from 5 mental health departments, psychiatry, psychology, social work, mental health education, and also the nursing department. All put together, we started training people, building capacity, and we did 39 programs, and the numbers are counting, and as many as about 28 collaborating organizations, and close to 30,000 beneficiaries who are trained in this process. I'll quickly give this thing. What is important is that these programs made a lot of difference. People went on to ask a repeat program for those who missed this thing. And time and again, we are recasting the same what we taught with our YouTube presentations, which are available, and some other recorded material which they can use. And this is going on. We also had a lot of participation from the Karnataka's Health University, who took our help, and they also participated. They educated people about the COVID. In addition to we focusing specifically on mental health concerns in very selected populations, I'm just giving the list. I'm not going into the details. We even spoke to obstetricians, pediatricians, lay counselors, postgraduates in other medical college hospitals, police officers. We did child protection officers, many volunteers who are working in NGOs. Very interestingly, our psychology department did a 3-hour training for as many as about 800 clinical psychologists or psychologists who are in the field, how they can counsel people when telephone counseling was requested by public. So this was something that was unique, and this program was done in 4 different batches of about 200 to 250 numbers, and this is still continuing, and more programs are happening. They also launched one portal, the Department of Clinical Psychology, where people put their questions, the answers are given back, and more people are benefiting from how to go through this content. As many as about 50 odd such questions have come, and for which some of them have been common, but nonetheless about 40 questions. We have put the answers back in that portal, and people are getting benefit from these portal-based training as well. For the list of program that we have done, I'm not going into those details. We did prepare many education materials for purposes of helping these COVID-related mental health concerns that the public and various groups might have had, starting from information pamphlets, videos, to very identified groups, whether it is mothers who are expecting pregnant women who are expecting children, or pregnant women who are feeding the babies, elderly population, children, people working in healthcare situations, the nurses. So for different groups of people, we prepared some video information which could be put on the website with developed posters. We, of course, spoke to many newspapers, and as many as about 100 newspaper articles, short to longer ones, have been written from MANS and many other colleagues who were associated with MANS. We also did scientific publications, and we sent a list of SMS messages which the government of India, the health department, would use and send periodically to many people in public domain. So many of these activities which have happened also were to be documented. Demands brought about a weekly bulletin of all activities that we were doing in this disaster situation to mitigate concerns and mental health problems in the public. And this bulletin became quite popular, electronic though. And we have now, with the things having been reached out in many forums, we have reduced it to a monthly brochure. Together, I must say, mental health received a great impetus during this COVID period, and thanks to many like-minded people, our colleagues. I forgot to mention one other development that has happened. Unfortunately, the slide got missed into this. During this time, the Medical Council of India also put forward the guidelines for telemedicine practice. Thanks to their introduction, psychiatry adopted it very well. We were doing telemedicine for a long time. We also brought, in collaboration with the Indian Psychiatric Society, a telemedicine guideline for psychiatry, and NIMHANS, with the help of the Indian Psychiatric Society, the national body, conducted several brief training programs, what we may call as the CMEs, for psychiatrists to be familiar with how to use the telemedicine services most efficiently, and be competent in terms of developing those web skills to be able to attend to people, and also use the prescription pattern in what is available. In thanks to our colleagues, we were able to get 2 additional medicines also to be included in the e-prescription platform in telemedicine. That included a benzodiazepine, clonazepam, and also a drug used in methylphenidate that is used in autism. So many things have happened. Essentially, I must make a comment that the concerns, challenges, adversaries of COVID were imminently converted into opportunities for introducing technology-based, easier healthcare delivery services from different platforms. And I must also thank the Health Secretary who wrote a very detailed press article on how important it is that we should be talking about mental health in this COVID scenario. Thanks once again. Thanks for having me called to this program.
Thank you, Dr. Gangadharji, for telling us the facilities that NIMHANS has provided to mitigate the effects of pandemic, especially your contribution in mental health of migrant workers, healthcare workers, specific vulnerable groups is particularly remarkable. Audience, we will have one more speaker, and after that we will take the question and answers for everybody. So I'll call upon the next speaker, and after that we will take the question and answer. Our next speaker is Dr. Rita Savla from Radhi Disaster and Education Foundation. Dr. Rita Savla is a practicing doctor. She is consultant to state of Odisha for Golden Hour Management in Trauma Patients. She is master trainers training. She has master trainers training from Primary Trauma Care Foundation UK. She has worked for more than 16 years in disaster risk management for urban and rural area. Her project, Give Way to Ambulance, is recognized across the country for its sustainable cultural change in the country. All the work that she has done in last 16 years are sustained, and till today it's operational at the ground level. I request Dr. Rita Savla to present her views on role of immunity to combat COVID-19 and give us a quick demonstration of the application self-immunity check. Over to you, Dr. Rita.
Thank you for Professor Major General N.K. Bindal sir for joining Radhi Foundation for organizing this most important topic is immunity and mental health in pandemic and concurrent disaster. I start with my topic with what Professor Santosh Kumar said. Like there is a one emergency in the family and how the entire family is under the stress. Unless it has been not taken care, it can go into the different aspect of disease, mental or physical. Now I take further Dr. Ganga Khedekar sir said, there are lots of things that are happening in current pandemic about medicines have been in the process of search, the vaccinations have been in process of research. We really don't know when the vaccination will come, when we'll get the right medication. These are all the future question marks. We have been locked down. We have been constantly been asked to wear the mask, which most of us are not comfortable. There is a social distancing which is happening, but in some crowded places, which is absolutely not possible. We have been asked to frequently wash hand. So many things are going around. And as rightly said, Major General Bindal sir said, like, we all are right from the top to the bottom in current situation that lots of uncertainty is happening. Now, immunity. Why we talked about the immunity? Even Ganga Khedekar sir also said about the immunity. What is the definition of immunity? Just give me 1 minute. Yeah. So, I'm very sorry, but something is wrong. Okay.
We can see your slide now.
Yeah. Immunity means the ability of the organism to resist the particular type of disease, the action of specific antibodies or sensitized white blood cells. Here, sensitized white blood cells means explain little later. The immune system protects the body against the disease or other potential damaging foreign bodies. I again read it, potentially damaging foreign bodies. When functioning properly, the immune system identifies and attacks the variety of threats, including viruses, bacteria, parasites, while distinguishing from our own healthy cells. Again, there's the immune system when healthy can identify the foreign bodies. Now, what impacts the factor which is impacting the immunity? Cortisol hormone. That's a stress relieving hormone. We all are in the stress, as everybody is aware. Even previous speakers spoke about the stress. And when the stress hormone, cortisol, has been released, over a period of time, it starts taking care of the body. But beyond that one point, it just gives away. And then instead of having a friendly approach with our own body, it reduces it start impairing the body, reduces the production of lymphocytes. Lymphocytes in common language is the army of our body. If the army is strong, we don't have a threat from outside. We have one major sir with us from the army. He will say, yeah, the internal system is strong, then the threat from the outside can be combated very well. So now current situation, I don't want to say that what is already said, like chronic stress is becoming, because 1 day, 2 day, 5 day, now it is almost 4 months. And this simple stress has started turning into the chronic stress. And this is the time we should intervene. And if this chronic stress is not addressed properly, we'll start developing inflammatory and autoimmune disorders. When stressed, body will produce more hormone cortisol. Again, if it is more, it is not friendly for the body. And then it can cause a struggle of the body, start struggling, and the body starts having inflammatory attacks. And when this inflammatory attacks happens, we have a low immunity, and anything from outside, like any foreign body, from outside can start affecting our body. Even when we are stressed, our digestion also becomes poor. When digestion is poor, whatever we are eating it, the required hormones, nutrition like vitamins, minerals, protein, carbohydrates, we are not able to digest. And if we don't have the required minerals, proteins, carbohydrates, vitamins, then again, body is not able to cope up. That mechanism, like, we need an army, like we need guns and fighter pistols and so many other things we need to fight with the people who are attacking us, our enemy. Same way it happens. Yeah. So what type of immunity people have? There is herd immunity. We have heard lots of things about herd immunity. We should have the herd immunity will develop, how the herd immunity will develop. Then immunity due to the medication or vaccination, or the self-immunity. Ganga Khedekar sir has already said about the immunity related to the vaccination and the medicine, which is in the process. We really don't know how long it will take. But if it is coming also in the market, how long it will take to reach us is also another question. Because everybody is, there are 8 billion people. India is 1.3 billion people. So the production and marketing and reaching to the ground level will take its own time. So now let's understand what is herd immunity. Herd immunity is a very simple thing. Either our body has some strong immunity, and when something from the foreign body comes and attacks, our body produces its antibodies, or through the vaccination we take an artificial thing and then we produce an antibodies. And then when actual virus attacks, our system know how to combat that virus, and we are able to save ourselves. We may not get that severe or may not be required ICU or hospitalization. But how this happens, herd immunity will also help when everybody has a lot stronger immunity at a larger population. A very small chunk of the people if having a low immunity, it will also ensure that they don't allow to spread the disease. So we will be able to cut the chain. And once we have cut the chain, we have probably combat the disease. So it is very important at this moment of time. If we are also fearing the second wave, as what had happened in the Spanish flu, more people died of the second wave, not of the first wave. So we need, before the second wave comes, we need to have a strong immunity, so we can cut the chain and we don't have that bad impact of second wave or current first wave also. Now what happens with the mental health immunity? Immunity is a combination of mental health, physical health and diet. So how it works, I will explain you a little in detail. We know there are many people around us who are very conscious about the diet. They will eat all the healthy food. They will be never eating junk food. They were particular about the timing of the food. Everything is perfect in themselves. And still we see them diseases. They say like we have been taking an immunity food. Most of our Indian food has immunity food already added into that. We always take haldi is all part of, turmeric is all part of our every food. Ginger is part of our every food. Garlic is part of our some food. So we are almost taking garam masala, whichever kadas and what we are making it, they already have it. So the food part has been already been taken care, and still then why we see people suffering it? In spite of we are taking immunity booster food, already we are taking it. Because we have been not working on the certain other part aspect of immunity. Then comes the physical health. Physical health is means like you have to do continuously your exercise, you need to be active, so your circulation happens very well, your body gets strength, stronger. Again, they both are dependent on each other. If you are eating good food, if your digestion is good, then you get all the nutrition, then you can be able to do the physical activity. But more than we have seen lots of people around us who are doing every morning going for a jogging, they're going to gym and they're doing yoga and everything, and still we see them with the supplements because they have not taken care of the most important part is mental health. And mental health is where if they along with physical health and diet, if not taken care as a package, then there the problem comes. Then we, in spite of having good food, good exercise, but we have not looked after our stress. Now everybody knows, what is mental health? Oh God, somebody saying me mad, I need a psychiatrist treatment. That's a very later stage. It's very far off stage. Let's talk about the initial beginning stage. So now we again, again we come back to the stress. So how this stress is happening around us? There are so many things, and easy to say, don't stress yourself. Everybody says, "Arey, stress kya lene ka?" Arey, that's good, yeah. I also don't want to take a stress, but how? We really don't know. Everybody says don't take gussa mat karo. Second part of psychological issue. But how? I also don't want to get angry, but how? I really don't. Then somebody said I have a mood swing. To do this, do that, but how? We really don't know. And that's where we really don't know how to do, and we more of fearing to even share with the people, because moment we talk little more about it, people will label us ye pagal hai, isko kuch mental hai. But that's very secondary stage. Now what we did at Radhi, we understood that every problem around what is happening about specifically during this current COVID. The thought of self-immunity also came from the people working in emergency. They started talking because we are continuously working with the government department, and myself as a doctor. So everybody was saying there's lots of not with ourselves, but our family member is trapped. Can you help us to do something? And there we realize how even the NIMHANS is doing such amazing work. But there are limitation of reaching to the people. With the telemedicine, they're able to reach so many people. Same way, we needed some technology where we could reach to many people. Here we thought of the self-immunity came when we were not able to cater so many people, and we got tired of answering the people's phone call. And most of the phone calls were also not able to express themselves. And there we realized where is the basic level of understanding what they even need to talk to the helpline numbers. There we started with self-immunity check. So it is a web application. It is already live web application, which you only need a smartphone and internet and browser. That's only 3 things. You don't need to download that. And it is in current situation, we have addressed and understood what are the problems. And this is the basic level of entry of understanding your mental health, physical health, and diet. All the 3 package we have been given. Because there are many things what we had understood. Like many people were talking about, doing survey, asking so many questions about the survey, and then people were giving yes or no answer. After that, what? Okay, I understood my problem. But after that, what? Nobody was giving the answer. And there we thought, after doing the survey, let's give them some recommendations. So they start working it. Then we realize also people are not open to discuss about their problems. So that's why we came down to the survey. The questionnaires were developed in a way, keeping this current situation into the mind. The questionnaires are very easy, very simple to answer. Anybody, right from the very educated to a non-educated person can answer. That simple language we have used it. Once people go through the start answering that, it is when you're talking to a system, you're not talking to any individual. So there will be openness and frankness will come. And whatever the recommendations are being given, it are given to you, not to anybody else. And thereby, because we Indians have a still taboo of not discussing, because we still fear somebody will label us. This is the system. You can talk to them. It is your friend. Self-immunity check is your friend, where you can talk to the system. System will answer you, come back again, see what is the change. So I'll just take you a small tour of how the self-immunity check looks alike. You can check into the self-immunity check through the two ways: selfimmunitycheck.radi.com, type it on your browser, or you can visit our website radi.com, radhee.radi.com, and there you can see the tab, check your immunity. Once you check your immunity, you see this page. It tells you why you should be doing it. I have a video about my also explaining about what to be done. And it is in two languages. It is in English and Hindi. We will be slowly adding multiple languages into that. Now there is a registration form. Why we are not asking anything in the registration, whatever the questionnaires are been there, it will be helping us, you give the customized recommendation. The system will be helping you to give the customized recommendation. Again, I've repeated, and that's why we want people to fill it up. Only the name you can give, any anonymous name or your name. We are not even asking your surname. We are not asking your middle name. Then we are asking you about email address. Very important for us, email address, so we can connect you with the newsletter. You are starting your journey of improving your immunity. It cannot come like, आज मैंने पढ़ा, कल मैंने implement किया, and I'm fine with it. No, that cannot happen. So you need to come back, you need to work, and you may have some problems. We have realized that. And according to time, we'll be sending you the newsletter, and through newsletter, we'll be helping you to your journey to strengthen your immunity. So that's the reason we needed an email address. What we know, we have not asked your WhatsApp number. We have not asked you any numbers. People are coming the next time, they can use their username for registration. Now that again we are explaining what is immunity, how it helps in detail. It is explaining what is immunity. Then you go to the mental health question. There are 18 questions taken care of in current situation. What should be the people will be suffering, and there when you start answering, when people start thinking and answering it. Then there are physical questions related to 16 questions related to physical health. Once they answer the physical health, system will give you the result. And then recommendation. The recommendation which are in general, recommendation are very well thought of. Taking care of, because it's a system. It's not one-to-one counseling where we know the particular problem of the people and then we start answering. And it is a work of so many people came together. We have our knowledge partner, Vidyalankar College, who joined us as a technology partner developing. The people are sitting. Thank you, sir. Then we have a Karve College, Karve Institute of Social Science, Joshi Vedekar College, Thane, then Mastermind Mind, who are working in emotional intelligence, and lots of volunteers who joined from subject matter experts who joined to develop this entire system. The questions and answers and recommendations are well thought and they're well customized. If you are answering 10 years, then you get answer according to that. If you're answering 5 years, you get answer according to that. And this is the beginning. I again say this is the beginning stage. This is a basic level of that. Once acceptance of basic level will come, then they can go to the advanced level, and system will allow them to go to the advanced level when they have finished and worked on their recommendations. The recommendation on physical health, what you need to do, how you need to be done. We heard lots of people talking about, do this, do that, do not that. But that was so difficult for people. That was confusing people, what to do, how to do. And there the experts have come together. So we didn't wanted to do it alone. We wanted to bring the experts also to talk about it. So when experts talk together, you can believe and trust in authenticity about it. And trust me, the solutions are very simple at the basic level. When you start working on that, you won't even need the advanced stage. Now there is a balance that we all are confused what to eat and how to eat, and somebody is recommending their product and somebody is doing this and that. This is what you should be doing it. This is everything what is written will be detailed one about what are the proteins, carbohydrates, sugar, fats, vitamins, minerals, everything required has been covered in this entire session of balanced diet. immunity booster drink, and power pack salad. The content what you will be eating it, you may not eat every content, but whatever available out of that, you should be adding into your daily diet, and that will help you to improve your immunity. So will it improve my immunity? The question will come. Will it improve it within 2 days, 3 days, 4 days, 5 days? No. It takes time. You know, everybody knows, you know, to break the thing is very easy. But when you join it, when you repair it, it takes time. And it is about your mental health. How can it be very next day? There is no shortcut. So please remember, friends, there is no shortcut, and you need to work on for a little longer time. Continuously, you need to work out. Don't work only one package of like, you know, I work only on the diet right now. I'm very happy with the diet which is given to me, or I'm just happy with doing my physical exercise, but I don't want to work on mental recommendation. No, you need to work on all together. And trust me, they're very easy to implement. We haven't given anything difficult. So then you come to the last page. Here you can, you know, with the last page, you can also become a warrior. So once you have done, you can again, if you're not a registered newsletter, you can again subscribe it. You can become a warrior by registering as a volunteer and enroll other people to become to take the tour on this entire self-immunity, and let them strengthen their immunity and their family members. So there is also the place where you can share that with the social media group. At the down page, there is a link, and there is a feedback form, where feedback form will be helping us how we improvise on the second level. And then there is a feedback if you have any question, if you have any query, so we'll be able to reply that. So we are really connected with you. We are just not leaving it. Again, I want to stress there is a minimum 6 to 8 weeks of the period you have to go for it. Don't think that in a 1 week or 2 weeks it will be happy. I'll be done with my strong. Yeah, slowly we will be improving it. But to strengthen that, you'll take a minimum some time. And it's like, okay, I've done it now. 8 weeks maine kaam kiya, now forget it. Can I come back to the normal? No. You need to continue. Once you have been improved yourself, when your thought process is increased, when you have increased your immunity, why you want to go back to the low immunity? So what benefit? I've already said so many benefits people can get. That once you improve the immunity, how the Major Bandal sir said, like, you know, there are many other diseases are coming. There is a plague is coming, some other black fever is coming, there are disasters are happening, monsoon diseases are coming. So how many vaccinations you are going to take? How many medicines you are going to overdose yourself? So this is the place where if your immunity is strong, without medication, you can develop the herd immunity, and then you could protect not only yourself, but the people around and all to the society also. You need to create a chain of people having herd immunity around us. And then only we can combat not only COVID, but any diseases. Additional help, what you will, once you're working on your mental health, you have more positivity around you. Home environment becomes very good. When you're developing healthy habits, healthy food, again further that keeps on improving yourself. And what best benefit? You don't need hospitalization, you don't need doctors, you don't need anything. So you're saving your money, your productivity is increased. So it's all lots of benefit you get by doing it. And best benefit, I don't have to tell my mental health problems to anybody. It's too only. And I'm improving myself. Without even telling, I start improving. And let the people comment. Arey yaar, tere mein bahut change aa gaya. Wow, you're looking very happy, you're looking very positive. So this is the platform which will help you to do and get the, without people knowing that you're working it, you will start improving on your mental health and physical health and diet and overall as a immunity. But government can get benefit. It is one of the preventive tools. It's not me who is saying. People who have got COVID, who are in hospital, we can just quote that they had a low immunity. And that's the reason. If somebody is getting disease, if they have a certain level of immunity, then only the medicine and vaccination will help. If you have very low immunity, medicine and vaccination will give lots of side effect. So even to avoid from the side effect, you need to work on immunity. Then only those medicines and vaccination will be helpful and friendly with you. Otherwise, they may not be. This is a very long-term sustainable approach to any disease during any specific event disaster. It will reduce burden on healthcare infrastructure, as Dr. Ganga Kedekar already said, like, amount of the population and the healthcare worker is absolutely not matching. The amount of diseases what we are having in India, India is becoming hub of this, above that, above this. This lifestyle disease also can be combated if we are working on the immunity. The back end what we'll having the data will be not the personal data, but certain data what the government can help in policy making and help in the planning for disaster or any health related issue. This will also help the promoting of the psychological helpline in better outcome. Currently, most of the people are not even able to talk about themselves. This will help in better utility of psychological helpline. Once the people is mentally sound, physically well, if you are mentally happy, sound, then you're physically also sound. That will increase the productivity of the country, and then we can become an improved country, and we could become a self-sufficient #1 country over a period of time. If the people have a good happy index, then the country has a better GDP. Now, when we are adding this in disaster management, people specifically who have joined who are part of disaster management or health planning from the respective state, the problem when we address at the grassroots level, it has a better outcome at any crisis comes. Stronger immunity will reduce the post-disaster outbreak of epidemic, psychological issues, suicide, and it will promote early recovery. Benefit to the citizen, to the country. Self-immunity check is a platform can be used for the awareness and enrollment as a part of capacity building to increase immunity and to break the cycle of an epidemic post-disaster. Regional language and voice features can be added for the illiterate and rural people. Self-immunity check is an entry point for the psychological first aid, which most of them in Nimhans has taken a lots of effort in psychological first aid post-disaster. This could be the entry point to reach to the many people. And specifically, the privacy policy of the application will enroll more people to be frank and resolve that mental health issue. Again, let's not talk about the mental health, let's talk about the stress. And we are reducing your stress, and that will make you a better person to live about. So, at this, when government is going to be very beneficial, if any state government would like to be enrolled with us, we'll be honored to be working with the state government on this entire topic of immunity by the self-immunity check platform. And we will be looking forward to how with this platform we reach to the maximum people and we strengthen their immunity. Not only we combat the COVID, but we also become instrumental in restarting the normal life. And I truly thank Major General Bindal sir and NIDM for giving me an opportunity to show the entire self-immunity check web platform. With that, I end my presentation. Back to the moderator.
Thank you, Dr. Rita. It was a very informative session. Thank you for creating such a fantastic platform for all of us to use. We will now start with the Q&A session. There are a lot of participants who have queries which they want to ask the delegates. So I'll just take a few questions as the time permits, and I request delegates to answer those queries that participants have. Ma'am, since we were discussing about immunity, my first question is to you, where the people are asking, is raw food safe in COVID scenario?
It is, certain raw foods are very safe in COVID scenario. So more than that, I will say what raw food you are able to digest. Everybody has a different acceptance of the body. So one should know what is very friendly with them. So they should be eating it. If the same food somebody can eat boil and they are able to happily digest, then they should be boiling it. Or if somebody can eat the same food raw and they can able to digest, they should be doing that. There is no fixed rule about this is the best or this is the best. I always say that understand your body and then eat. Don't copy anybody.
Okay. I have a question. What is a privacy policy related to your platform? Because even there is a fear among people related to such platforms that the data related will be given to some pharmaceutical companies or something. It's a straightforward question. Will you keep it in private? And who all can access this particular platform?
Yeah, very good question, sir. This data is totally confidential. It will be not shared with any pharmaceutical company. Right now, I'm saying it because it will be not helpful for the pharmaceutical company as because we are not taking anybody's name. We are not taking a detailed address of the person. We are not taking WhatsApp number of the person. And what email we are taking, it will go only to the platform where it is encrypted very well, so there is no person like I really don't know what answer you have given. The backend data, what we'll have, we may have the comparative study. Okay, 100 people give the question A yes, or 200 people give the question B yes. That way of the very generalized data we will have. Of course, we will be sharing this data with the government if required, but that will be a very generalized data. It will be not in particular person because we really, government doesn't know the person. If you go to the registration form, ask about your name. It doesn't ask about the middle name or surname. It asks about your address in terms of PIN code number. You pass the state and taluk and PIN code number. We are not asking which street you are staying in, which is your house number. We are not asking your WhatsApp number or mobile number. We are not asking. We are asking only email address to send you the newsletter. So one can be very much sure about it. Even we don't know what question and answer you are giving it. It's a generalized statement where we get the maybe the analysis will be that if 500 people have answered A yes and 500 have answered B yes, or 1,000 people have answered C no. That's where we'll have the data. I hope I gave you the satisfied answer.
Thank you very much, ma'am. Thank you very much.
How do you ensure that all hospitals are disposing COVID-19 treatment correctly?
No, there are advisories given by the Indian Council of Medical Research and the Health Department. And I'm sure the treatment plan that has been followed in all the hospitals conforms to this as of today. There are, of course, some additions that each doctor can make depending upon his clinical situation. But the minimum treatment plan that has been approved by the advisories of the Indian Council of Medical Research and the Government of India Health Department, and state to state they also release advisories, and these are followed very diligently. More so, this is a public health important disease.
Thank you, sir.
There are detailed guidelines issued by NCDC on disposal, hospital disposal, which have been already circulated, and hopefully all of them are adhering to it. However, I understand the tone of the question and an unasked issue. That the issue of disposal is going to become more and more complicated because the number of PPEs that you are likely to dispose of is going to be high, and therefore there is also an effort to develop reusable PPEs as one of the responses, but we are yet to reach there.
There was a question raised I saw the chat box about use of yoga. I must say that Nimans did a yoga program. Of course, there are many schools of yoga who have been promoting yoga for people who are affected with mental health symptoms during this pandemic, those who are affected with the COVID infection, having mental health problems, and those who have respiratory problems until they go into a ventilator. What are the things that they can do? Some of the pranayama exercises which they teach. Many of these things have been advocated. In this context, we did a tele-yoga program. That is, we taught yoga and a module which is about 20 minutes program to reduce stress in people who are experiencing this during the COVID pandemic. And we have had some results indicating that this experience was very supportive to them. And we have now launched a tele-yoga program from the NIMHANS website. People who have an access to any of the Zoom or I'm not sure, the website of NIMHANS Yoga Services has this information as to how you can log on. One, it starts at 5 o'clock in the morning. Another one, which starts at 5 o'clock in the evening. The program at 5 o'clock in the morning is generally used by international people. One at the 5 o'clock in the evening, many national people are using it. The website, I have already put it on a chat box. The person who raised the question would probably have it already.
Good morning, sir. I am Bijit from Kerala. I wish to ask a question related to conflicts. Every pandemic is related, causes a social conflict. So as a mental health worker or as a person who is working in the field of mental health, how can we take steps to mitigate the effect of social conflict during the time of disaster or pandemic?
Conflicts have various reasons, sir. One is being transparent about giving information about COVID, about its management, about its care, etc., etc. Being transparent is one general source of mitigating conflict. I think we have to follow that. Secondly, we have to be up to date about the procedures advised by the government from various health departments as to what should be done for treatment, for quarantining, for a testing, for asymptomatic people who are tested positive, for migrant workers, for the health workers, and advisories that have come from the ministry. It's a good idea that any person working in the COVID area, whether a mental health worker or a general health worker, becomes familiarized with all the advisories that are given by the health department, center and state organizations like ICMR. If you have everything at your fingertip, you will probably be able to provide the best information. The better is the information, the lesser is the likelihood of getting into conflicts.
So there is one question which is there any plan of promoting community level PSS workers program to address the present need?
It would be required, but at this point of time, we are developing a manual for mental health workers, a manual for health workers, which will also contain how to mitigate mental health concerns. Whether we should launch a public health model is something that we are working on. The government of India has given a task of developing such a program or a manual, and we are at it. It would probably be rolled out very early.
Sir, at this moment, I would like to add, along with the manual, if we could join hands to put it on the how we have developed the self-immunity check. That will, these people can enroll more people specifically to address the psychological first aid or the mental health at the ground level. So we can reach at the wider place, because human intervention reaching to the people has its own constraint. So if we could also do that together.
Yes, madam. It's a good idea. I think we will do that. Some of the platforms, some of the training programs are announced on the NIMHANS website from time to time. Particularly the mental health telephone counseling training to psychologists. There was a excellent participation. Similar counseling skills to nurses in the community. There has been a good participation. Whether we're going to make it as a capsule of program to be taken from a top-down methodology, we're probably going to come up shortly if that is possible.
Sir, I surely look forward to speak to you on this topic offline.
Surely, madam, we will definitely do that.
Yeah, thank you, sir.
There is a department, there is a section called as disaster management, psychosocial stress reduction during disaster management. Professor Shekhar, who is the professor of psychiatric social work, heads this program, and we have done several activities. I only given some of them, not all though. You will probably benefit from getting in touch with Dr. Shekhar directly so that you launch the program.
Sure, sir. We look forward to get associated with Nimans.
Yes, madam.
Thank you, sir.
Sir, I'll take just one last question. There is a question which participant has asked. Is there an index for immunity which can be measured? Could we prescribe the steps on how to improve immunity?
Yes, there are index to measure the immunity, but those cannot be measured by in a such type of a self-immunity check platform. And specifically, currently we are talking about the basic level of immunity, entry point of awareness and basic level of immunity. Once the people go into the advanced stage, when our advanced stage will come, in that we will be also having index of rating the people and then working little more deeper with the people. Let the people go from the first standard to then 10th standard, because once we start talking about rating the person and scoring the person, it is like, going higher above. Let's start from the first standard and then go to the 10th standard. There was a one question which I saw about the food part of it. Let me take somebody said the veg food and non-veg food. It is about we have given more concentration only on the vegetarian food because it also covers everything. But if you are a non-vegetarian, I'm basically a pure vegetarian person, but my colleague Asif is a pure non-vegetarian person. So it is all depends what you want to eat. But ensure that what you are eating, it is very fresh. When you are taking any non-veg, ensure that it is coming from the right resources. It is not heavily chemical, given lots of antibiotics to keep it fresh. But vegetarian food, you can see whether it is fresh or not fresh. You can easily discard. Eat whatever you're eating fresh. There was one more question which I see, that herd immunity is just an theory. No, herd immunity is a fact. Anybody working on if you have a strong immunity, you develop herd immunity. If you don't have a strong immunity, you don't develop the herd, then you suffer the disease. So it's not a theory, it's a fact, proven fact.
Yeah, I have a question. Myself, Bishwanath from Kolkata. That what is the thinking by the government and the authorities regarding the mental health of children? As because they are sitting at home, they can't go out for play for to meet their friends, and they are very much depressed. In this situation, what is the thinking of the government for them? If you are coming out with any sorts of things for them.
Yeah, a video has been made about what you should do mental health in children during the lockdown and COVID period. I'm sure this should be available right now on the website. If it is not, we will try to reach it out to you. Number one. Number two, the Child and Women Ministry has launched a program about concerns in children and how to educate the people, protection in the COVID period, the conflict somebody mentioned, how they can be protected from getting into these conflicts, particularly abuse and things such as that. So again, a large project has been taken up by the Child and Women's Welfare Department, which one of our colleagues at NIMHANS, a professor in the Child and Mental Health, Child and Adolescent Mental Health Department, is running it, which is any moment it will be launching out to reach as many people as possible, child protection officers, psychologists, social workers, nurses, whom this education will be given, how to handle some of the concerns, if not all concerns of child mental.
Into that, we did this application right now is above 17 and above 17 years of age, because when we talk about addressing the mental health, with the age, the approach will be different, the problems will be different. So soon we will be also coming with the 2 sets or 3 sets of another symptom modules, where we'll be addressing the different type from the toddler to the age of 17. So please do keep on connecting with us and keep on spreading the entire web application to the maximum people, so we develop the strong immunity. And we will be doing it now. We are also partnering with many more organizations, so that will make us easy, and whatever the material they have, it could be better way to reach to the people. through this web application. I hope I've answered me and sir both have answered your question.
Ma'am, this question is for Dr. Govt. A good percentage of our health workers are women. So, are there any specific measures which have been undertaken for the women health workers?
See, let me be very brief in answering. There has been very little response time that we had so far. The most of the energies were spent towards prioritized issues which would have direct impact or direct occurrences that you might see. Issues related to women have not been separately addressed so far.
We have to be mindful of the time. We are almost there at the conclusion. So I think we'll if anybody has any more questions, they can email it to us at info@radi.com or NIDM email address. To conclude today's session, I'll highlight a few points that our eminent speakers brought up. I think the points that came up was importance of immunity in our fight against COVID and even in our day-to-day life. Right actions that we took like early lockdown and training healthcare workers, importance of early detection and contact tracing and isolation, delivery of healthcare services through innovative means like teleconsultation, strategies to mitigate burnout and importance of taking care of our healthcare workers, NIMHAN's contribution in mental health of migrant workers, healthcare workers, and specific vulnerable groups, detailed understanding of immunity, importance of mental health supported by physical health and diet for immunity, demonstration of self-immunity check, which could be the entry point in breaking the taboo on mental health and getting people to seek professional help. And I think that all the Q&As that our speakers have addressed, I'll request Ms. Zara Diwan. She's a clinical psychologist and team member of self-immunity check application to give a vote of thanks for today's webinar to all our eminent speakers.
Namaste everyone. I hope you all had an enlightening Friday afternoon listening to our extremely erudite and highly proficient speakers. I'm Zara Diwan. On behalf of Rade Disaster and Education Foundation, we greatly appreciate everyone who has participated. I take this opportunity to thank the NIDM Executive Director, Major General M.K. Bindal, for giving us an opportunity and the resources to organize and make this webinar successful. I'd like to thank you for your inspirational keynote address. I also would like to thank Professor Santosh Kumar for the welcome speech and setting the context for our audience on the subject. I would like to thank Dr. Raman Gangadhar, the chair of ICMR, for the enlightening talk on the pandemic challenges and the probable solutions. I would also like to thank Dr. B.N. Gangadhar, director of NIMHANS, for giving us insights on the importance of mental health for all populations and all groups. I'd like to thank Dr. Rita Savla for highlighting the participants on the role of immunity to combat COVID-19 and demonstrating the self-immunity check, and very important and initiative and the need of the hour in the current situation. I'd like to thank Mr. Asif Reshamwala for effectively moderating this webinar. I also would like to thank Dr. Ajender Walia, Assistant Professor of NIDM, for coordinating the webinar. Her efforts were imperative in making this program successful. I want to thank Professor Surya Prakash for guiding us so that we have a successful outcome. I want to thank the entire team of NIDM, Mr. Hemant Kumar, Mr. Balaji, for managing the webinar platform and registration and making this program successful. I would like to thank all the health and state disaster management officers from state and district for their active participation. Lastly, but not the least, I would like to thank the participants for joining us and making this entire program meaningful and successful. Thank you, everyone. Jai Hind.